everyone, Miss B here. Today we are going to talk about rehab for an athlete with a paraspinal strain. So one thing that's really important is to remember is that your core not only targets the anterior portion of your body, but also the posterior. So whenever we're rehabilitating a back injury, we always want to mix in core stability somewhere, wherever we can, into the rehabilitation. So today, our injured athlete is Joe, and our Rowan representation is the Ruat hat. Okay, let's get started. Don't forget to sweat before you stretch. So now that we've warmed up, we're going to work range of motion. So we're going to do that with some gentle stretching. One thing to be mindful of, whether they have a paraspinal strain or another back injury such as a spondy or a disc herniation, is to be mindful of different ranges of motions that could be painful to your athlete. So we're going to start with one that's pretty comfortable for most back injuries, and that is the knee to chest stretch.
Instruct your athlete to start with a single leg, knee to chest, and progress to double leg when comfortable. Hold each of these stretches for 30 seconds, 3 times through.
So the next one we're going to discuss is the child's pose. So what you're going to do is have them start on their hands and knees in the quadruped position and just have them sit gently back on their heels, good, while extending their arms in front of them. Next we have the crossover stretch. So you're going to have them start in the supine position. You're going to have them take one knee and cross it over their body while grabbing with their opposite arm. Go ahead, pull it over. The important thing to remember here is to make sure that they have their opposite shoulder down on the table. If that's coming up, you're not going to get the appropriate stretch to the back structures that you want. So the next one is the Sphinx pose. So you're going to have them starting prone, and they're going to push up onto their elbows. Good. So what you want to be mindful of is that extension in the back. If they're dealing with a spondy injury, this may be uncomfortable for them. So you may have to avoid this in the beginning of a spondy rehab. So we all know that tight hamstrings can definitely lead to a low back injury. So we always want to incorporate a hamstring stretch somewhere in that back injury rehab.
Loop the band around your athlete's foot and have them gently pull up. If the hamstring is too tight to have the knee completely straight, have them bend it slightly and then pull back further.
Next up, we have the chair stretch. So you're going to find a chair in your facility.
Have your athlete bend over, grabbing onto one of the legs.
You want to be mindful, if they have a disc herniation, that forward flexion may be painful for them, so you'd want to avoid this in the early stages of that rehab. We're going to move on to some strengthening exercises. But before we start with that, we want to make sure that we find pelvic neutral. So what we're going to have the athlete do is some pelvic tilts to find that neutral position of their hips.
To find pelvic neutral, you want to instruct your athlete to arch their back up off the ground. This will tilt their hips anteriorly. Then you want to instruct them to smush their back into the ground, tilting their hips posteriorly. Continue to do this until you find a good neutral position right in the middle of the two that you can tell them to keep this pelvic neutral as they do the rest of their exercises.
Another exercise you can do starting in that quadruped position is a bird dog.
Instruct your athlete to reach out in front of them with one hand and the opposite leg out behind them. Then they can switch. Make sure that you keep your back and hips from tilting while you do this exercise.
So dead bugs are basically an upside down bird dog. So you're going to have them starting on their back, hands and knees up in the air, and you're going to have them drop one arm and the opposite leg. So you can start with your right arm, left leg. Good. Bring it back together, and then opposite. Good. Next we have a hip bridge. So we're going to instruct the athlete to start on their back, knees bent, feet flat on the floor or table.
Next, have your athletes lift their hips towards the ceiling, hold for 1,000, 2, 1,003, and then slowly lower back down.
Next, we have a Superman that we will progress into a back extension. But we're going to start with the Superman. They're going to be laying flat on their stomach. They're going to lift their arms up off the floor as best they can. And then they can also lift their feet if they're able to do it. Next, we've got a plank, which you can use so many different variations of a plank, but the standard plank is going to be starting on your elbows, back nice and straight, feet apart about hip width, and we're going to hold this for as long as you want to challenge the athlete. So it could be 30 seconds to a minute or longer. So next we have a ball crunch. So you're going to want to have your athlete start with their back on the exercise ball, hips off of the ball. You're going to instruct them to cross their arms across their shoulders, and then they're going to crunch up while keeping their chin towards the ceiling. Hold at the top for a good 3 seconds and then lower back. Up. They're doing it right. You should see a little shake at the top. Good.
The goal of our beginner phase is to make sure that the athlete has full, pain-free range of motion before moving on to any advanced exercises. This is all for today. Please come back for part 2 of back rehab and core stability.